Okay, in your elbow here, what we're dealing with, let's just bring that back up. There we go. All right, so in your elbow, think about it like a hinge joint.
Mm-hmm.
Flexion, extension. So it pretty much does this, flexes, goes this way, but there's a little bit of that extra rotation, right? There's that type of movement and that type of movement. Great arrows there. So what we can do is, what helps create that movement is this radial head. This is called the annular ligament. Let's not talk about that right now. But this is the radial head.
Okay.
And if you think about that radial head or that radius bone, what it helps to do, it actually does this.
Mm-hmm.
So when you rotate, you'll feel this right there. Sometimes what can happen in this radial head is it gets a little stuck and gunky,
Mm-hmm.
especially around that annular ligament there. So let's just go to this side. That annular ligament right there is
Mm-hmm.
like, so imagine here, and I created like a little bit of band right across, and now this is starting to pivot across, but this is like bear down. And so now it's like, it's not really moving very well.
Okay.
And so when you get some resistance, like going palm down, I baller it,
A little bit, yeah.
and then you go palm up, it really creates more strain that way. And that's why when you kind of lock it out and you're trying to really screw it in, like the flexion extension was fine. I did the bicep test to you. I did the extension test. I did some ligament testing. No problem. The only thing that really bothered you was actually the rotation and loading of it, which gives me indication there. I tested a little bit of your arm, elbow, neck. No nerve related.
Okay.
So there's a reason why this is tender. This is creating a lot more force than it needs to.
Okay.
Because the ligaments aren't doing the job and the bone isn't doing for some reason it's not gliding and sliding the way it should.
Okay.
Just think about I guess anything that's stuck. Like, it's just not, if it's not sliding, then it's stuck. And if it's stuck, something has to create those forces or compensate for those forces. And I think in this case, these things are working a little bit overtime. So yeah, we can soothe this by doing some other stuff.
Okay.
But I definitely think that this is we have to get in there a little bit, especially if that's your firing arm, you're constantly like this, you're on a computer,
Mm-hmm.
all these years, 25 plus years at work.
I feel like my grip, like, would it affect my grip strength?
100%.
Okay, because I definitely
100%.
feel like my grip strength is way less on my right hand than it is on my left. And
So-
I'm right-handed, so.
So if we talk about, oh, there he goes. I don't have to keep doing that. So remember when we were talking about this muscle being really sore,
Mm-hmm.
or I should say these muscles, these are the extensor digits. So right,
Okay.
so if this thing is overworked,
Mm-hmm.
an overworked muscle is a weak muscle. An underworked muscle is still a weak muscle
Okay.
too. Think about it like this. You go to the gym and you go outside and you run 10 miles. And the next day somebody says, hey, let's run 10 miles today, and you're exhausted.
Mm-hmm.
Do you really think you're going to perform as well?
Mm-mm.
No. So your grip strength is going to be reduced by over usage of that muscle in that case. In your heel, a lot of times people have Achilles issues. Now the Achilles tendon is actually a combination of the gastroc and the soleus combined. So underneath this muscle, we have the soleus muscle, which is actually the more powerful muscle than the calf.
Okay.
Just the calf one's the beautiful one that you can see. But they come together and create this beautiful Achilles tendon. Now the Achilles tendon truly actually attaches at the bottom of the foot, but it has connections around that foot. Check that out.
That's cool.
So what I think would be good for you is, because actually realistically, you ever hear of fascia?
Mm-hmm.
Fascia is like a connective tissue, so imagine like a spider web,
Mm-hmm.
and it connects everything together, so it's like a bunch of overlapping and and that's my pretty drawing. But what that will do is that it will create a fascial connection between the plantar fascia and this type of fascia. And sometimes what can happen is that you can get overly tense from here, you can get overly tense from here. The thing is, if we go ahead and do soft tissue work extremely aggressively on this tendon, you're going to hate me, and you're probably never going to come back, because most people try to scrape the hell out of that. They try to work the heck out of it, and this is a great way to create more problems.
Okay.
What we need to do is focus more on the calf release, gentle movement there and some movement throughout here. Sometimes you'll get some pain through here, which, that's what I was trying to pinpoint.
Mm-hmm.
That's typically the picturesque spot for plantar fasciitis. I don't think you're having true plantar fasciitis though.
Okay.
I think you're just having a tendon insertion issue.
Okay.
That's creating maybe some other issues. I tested your ligaments and your strength. Everything's good to go.
Okay.
So you have a lot of easy problems to deal with that have just been chronic.
Right.
And that's the hard part. And chronic is defined by 3 months or 90 days or more, 3 months or more.
Mm-hmm.
So by definition, most of it's chronic now, so it becomes a little bit harder to treat.
Okay.
But it's not neurologic based, in my opinion. I guess everything's neurologic based, but it's not like truly a nerve is affected for you. And I tested it out, and I just think it's going to require some work to get in there.
Okay.
And we're going to start right away.
Okay.
Any questions?
No.
All right, let's do this.